A 20 years old male present with tense swollen knee joint. There is no history of antecedent trauma. On examination, joint is tense and swollen, but there is no sign of the injury. Plain X-ray shows no fracture or arthritis. What is the most likely explanation? So it is a case, and here we can see a 20 years old male present with tense swollen knee joint. That means the knee joint swollen, but there is no history of any type of the trauma, and also there is no sign of the injury, no fracture, no arthritis. So nothing happened of the knee joint, but knee joint is the swollen. What is the cause? As there is no history of the trauma, that means there is no outside injury. So injury is within the body system. So what may be the options? Here the answering options are rupture of the anterior cruciate ligament, rupture of the medial collateral ligament, tibial plateau fracture, hemophilia A, von Willebrand disease. As there is no history of the trauma, so the anterior cruciate ligament, medial collateral ligament, they are not injured. Also the tibial plateau fracture, so it is also not true. So we have to differentiate between the hemophilia A and von Willebrand disease, because in the upper T option, that means the rupture of the anterior or posterior cruciate ligament or medial lateral collateral ligament or tibial plateau fracture, there should be obvious history of the trauma, but as there is no history of the trauma, so it may be hemophilia or von Willebrand disease. So now see the hemorrhagitis, hemorrhagosis without trauma, that means the joint swelling without any history of the trauma. It is typically feature of the hemophilia A and B. Without history of trauma, ligament rupture or tibial plateau fracture would be unusual. So, and without trauma, there is ligament rupture or the bone injury or plateau fracture, it is not possible. Hemarthrosis may occur in 45% patient with severe von Willebrand disease, but it is rare. The hemarthrosis is also occurs in case of the von Willebrand disease, but here we have to keep in mind that it is very rare, as the von Willebrand disease is very rare. So here the hemophilia A or B is the first option. Here we can see the hemophilia, what occurs in case of the hemophilia. Here we can see a tear of the vessel and also the platelet and clotting factors here. And there is the uncontrolled bleeding. Now see some important factor which affects the coagulation factor. First of all, the heparin or heparan sulfate. Heparan sulfate usually normally present in our body, and it prevent activation of the factor 2, 7, 2, 9, 10, 11. Warfarin, it 2, 7, 9, 10. DIC 125, 81. Liver disease 125, 7, 9, 10, 11. And in case of hemophilia, APTT usually increase and other findings normal. In case of von Willebrand disease, here the APTT increase and bleeding time increase, but PT normal. In case of vitamin K deficiency, APTT increase and PT increase. So what is the answer? The answer is the hemophilia A, because hemophilia A is very common, and here there is no history of the trauma. As there is no history of the trauma, so no ligament rupture, no fracture, and the hemophilia or von Willebrand disease, but most common is hemophilia A, and von Willebrand disease usually a rare cause. So our answer is the hemophilia A.